Good day everyone, I am Flores and I'll be presenting to you case number 15. So it was mentioned that the patient is a few hours post-operative and is in a considerable amount of pain. It was mentioned that the patient was refusing the meperidine or Demerol that was ordered by the physician. So as per the basic concept, meperidine or Demerol is actually a synthetic analgesic, meaning it is man-made but has the potential just like a natural opioid. It's also a narcotic analgesic, meaning it is a controlled substance and has a tendency for toxicity. So it's usually used as pre-operative medicines, as support to anesthesia, and as painkillers. So it was usually given as 50 to 150 milligrams with the oral route, the subcutaneous route, the IM route. Usually it is given every 3 to 4 hours. And usually this is administered to patients who are suffering with acute severe pain and not chronic severe pain, since there is a tendency of toxicity. So just like any other drug, it has adverse effects, just like mabagal na paghinga or mahirap huminga. You have yung magaan ng ulo, nahihilo, nahihirapang tumae, namamayat, at namamawis. So just like any other drug. It was also mentioned that the patient is a few hours post-operative. So there is a tendency that the patient is still disoriented and may not be a reliable source of information. So I'll give you an example of a patient that is still under the influence or may still be under the influence of anesthesia. Okay, just like that. Just like that, the patient is still disoriented. So that is one of the possible reasons that may be causing the refusal of the patient. So the patient is still disoriented and may still be under the influence of anesthesia, so the pain is still tolerable. Since anesthesia takes about 24 hours to wear off after the procedure. So in this case, if the patient is still disoriented, you can have an initial assessment. See if the patient will be a reliable source for this. And then as per the registered nurse that I have interviewed, she mentioned that you may administer the drug pro nata or only as needed by the patient if it was already verbalized that the pain was tolerable. If you want to be sure, you can consult the patient's physician, ask if you can do so. And there is also a tendency that the patient is anxious, or there are concerns, or the patient does not understand the concepts, or the patient might want to be alert. So there was another patient that I have interviewed wherein they had an experience where they woke up and they were still under the influence of anesthesia and they could not feel anything, and they mentioned that it to be very traumatizing. So in this case, you have to assure your client that everything will be okay, everything is for their good and for their faster recovery. But of course, you have to acknowledge their concern. Another reason would be afraid of addiction or the discovery of drug tolerance. Since I have mentioned that this is a controlled substance, so tendency of a dose for a long period of time may cause addiction, or the patient may be a drug addict, and then you will be needing a higher dose for this patient for the drug to work. So you may discover this part. So with this, you have to establish rapport, get your patient's trust, and you should say that your secret is mine and every information we have is actually a private one. And then to verbalize all this, if you are the nurse, you can say that, okay ma'am, naiintindihan ko po na siguro po hindi niyo pa po masyadong nararamdaman na po yung sakit since kagagaling lang po natin sa anesthesia. So okay lang naman po, consult ko na lang kay doktor kung pwede po, kung kailangan niyo na lang po ibigay yung gamot. And kung natatakot naman po kayo, katulad ng dati, huwag po kayo mag-alala. Ginagawa ko lang po ito para sa ikabibilis at ikabubuti po ng inyong paggaling. Kung hindi niyo po talaga gusto pa or kailangan pa yung ating gamot, pwede po akong bumalik, tawagin niyo na lang po ako or check ko po kayo. And then kung meron po kayong gustong sabihin, okay na naman po. Kung wala naman po, babalik na lang po ako, tawagin niyo na lang po ako kung kailangan niyo na po ako. Also use the painkiller as anti-inflammatory. So that is all for case number 15. Thank you, and I hope you have understand.